Hi everyone, I'm Danielle Matias here at Caring Medical Florida along with Dr. Russ Hauser talking today about TMJ disorders.
Here, you and I, we were talking about, it just seems like certain conditions just are getting worse and worse and worse. Like back in the day, occasionally you'd see a TMJ thing, and this is just my assessment. I don't know what your assessment is, but I just think there just seems like there's more stress in the world.
100%.
There's more stress in the world than people at night. It's almost like everybody now is clenching.
Yeah.
And then the strongest muscle in the body is the masseter muscle. So the joint that has to handle the forces of all that clenching and grinding is the TMJ. And then, of course, eventually you get pain. And the reason that we're making this video is it's hard to imagine such a dinky joint.
Dinky joint, okay.
No, but you know what I mean? How little it is? Anybody can feel their TMJ joint, but man, this thing can cause a lot of problems.
Yeah, absolutely, I agree. I mean, people get like terrible headaches and, things like that from TMJ. I had a patient once who literally could not even eat. Everything he ate had to be so soft. No going out for a burger. That was never a thing because of his TMJ pain. So this actually is a pretty good illustration of the TMJ. So you have your bones here in the joint cavity. There is a disc, that purple, and then all held together by ligaments that support that joint and hold it all in place.
I think a lot of people don't realize that those ligaments, they actually go to the ear.
Yeah,
they go to your middle ear. And then there's different names for those ligaments, but one of the names of this ligament is Pinto's ligament. So it's also called the discomalleolus ligament, but basically that's the connection between the ear, Meniere's disease, dizziness, vestibular neuritis, whatever condition relates to the hearing, and then of course TMJ disorders can affect hearing.
When you're on an airplane and your ear is clogged, and then people will do a TMJ manipulation, and then it kind of clears their ear right up.
Here, since we're talking about this, even though there's not a slide for it, we're going to go off the slides.
Oh boy.
So basically what you're talking about is eustachian tube dysfunction.
Yeah.
So jaw problems can cause eustachian tube dysfunction. So we're all going to do this. So pinch your nose, then swallow 3 times. Okay, so with me, if I'm honest, this popped way sooner than this one. I did get a pop in this one. So I have a very small amount of right eustachian tube dysfunction. And then, depending on how much I grind at night, sort of depends on how much. And I've worked hard at trying to reduce it. But it doesn't mean every eustachian tube dysfunction you got to get prolotherapy or this or that. But I'm just trying to show that jaw problems can cause eustachian tube dysfunctions. So that means that your middle ear can't drain. So then you get fluid in the middle ear. Then sound, you can't hear sound as good. So if anybody has ear fullness on one side and their jaw kind of, when they open or close it, it goes crooked, or they have pain, there's a jaw issue. And most people with a jaw issue, of course, would go to a dentist, and sometimes a better place to go might be a prolotherapist in some situations. Some situations, it's better to go to the dentist.
I just think of what you said about my hearing. Recently, a separate story, I had my hearing checked and they said it was perfect. And I was like, I don't understand how. My house is so loud. My Apple Watch tells me, I need to leave the environment. So I just assume I have bad hearing. I can't leave because I'm home.
I can't leave.
Yeah,
that's fun.
So that's fine. Yeah. Okay.
That's fun.
Yeah. Okay, so a lot of times we talk a lot about clicking, popping, grinding, all those kind of sounds that joints can make. So especially in the jaw, there are people that we see, they open and close their mouth. It's click, pop, snap, all of it. Maybe worse on one side. If the disc is moved in a way where it kind of gets stuck or it's dislodged and not moving, it'll actually affect how much you open your mouth, right? Exactly. Too, and can cause a lot of pain and cause a lot of symptoms and sounds.
They say 3 finger breaths is normal. So if you can't open your mouth more than 3 or more finger breaths, there's a problem. Yeah. Houston, there's a problem. This is Izzy who's doing the filming right now. And then, you could see where the jaw is forward and then the jaw is back. And then what we do in the office here is we actually see whether your jugular veins, which are right here, whether they are more open or more closed with jaw problems. And that's one of the clues, of course, that there actually is a jaw problem potentially causing a brain problem. I just call it mandibular displacement or mandibular dysfunction. It's affecting how your brain drains. So that's like the connection.
This is a long time ago. May have been when I had just started working at Caring Medical. I had some neck TMJ things, and I remember one time I was riding in a car and I yawned, and my right jaw popped when I yawned, and then immediately I had full range of motion in my neck.
Yeah.
Like I had been like limited, kind of like how you feel if you sleep on it kind of wrong. But it was interesting because as I was learning too, I was like, oh my gosh, like here I am on a case study.
No, but the opposite can happen too. When I would go to an upper cervical chiropractor and get a good adjustment, then my feels better.
I believe it.
And you can see where here with our cone beam, this is something we do in the office. See how it subluxes?
Yeah.
It's basically on both sides. That's supposed to be in the middle.
Yep. Just be right back here.
So even Izzy this morning said she got an adjustment on this. So it's likely, and she feels so much better today.
Yeah.
Like she's actually been in a good mood. No, just joking. She's always in a good mood. I think Izzy's case, not to give too much medical information, but she won't mind me saying this, there's just people that are so loose jointed.
Yeah.
And then the first thing isn't every time Izzy gets something out of whack. Like she has young kids too. So like you guys are working full time. You go home, you have a full time job with all the kids, let alone your husbands. But I think you both got great husbands. But things are going to go out. So the first thing isn't like, oh, get Dr. Hauser or Danielle, get your needles out. You know, if she has to keep going back there every 2 days, at some point you're going to say, hey, I'm going to get you in really good alignment. Now we're going to glue it in. We're going to glue it in with Prolotherapy. So I appreciate her sharing that because there's lots of different ways. Like we're going to talk about oral appliances. Mm-hmm. Now we just talked about adjustments.
Well, I think that's what you're saying is true. Like especially, and it could be, Izzy and I have a lot of young kids, or it could be anybody, in any other kind of situation where you're like, gosh, what happened? Or is it that I'm constantly carrying toddlers up the stairs or getting people out of car seats in like weird positions? Yeah. What am I doing that's constantly kind of throwing me out of whack too?
I'm going to explain too, one of the things that I think causes it. You don't realize how many times you jut your chin forward. See when I'm jutting, see how like you just don't realize. Can you imagine like if I saw you guys at home? No, I'm serious. They're like maybe we just call it the chicken. Yeah. Like it's too much of the chicken.
Yeah.
But that's not good posture because you're not,
So you're saying you're going to come to our houses and help so we don't have to do that as much. I love it. I'm on board. Sounds great.
These are just some of the measurements. I mean, we don't have to go into all the detail with it. The point is that mandibular dysfunction, mandibular displacement, it can affect the space where the vagus nerve is, the jugular vein, and if that space gets too narrowed. In this particular person, see how it's 5? So that's basically the space between either C2 or C1 and the mandible. Okay. So the space between C2 and C1. So see how it's 5 millimeters. Yep. Then when the person jutted their chin forward, it basically doubled.
A lot more space.
So that when they do oral appliances, or we tell people, have your tongue on the roof of your mouth, and that's how we're supposed to be. It pushes the jaw forward, which gives this more space for the vagus nerve. And of course, if the vagus nerve is getting injured, that can affect, you could get stomach issues, digestive issues, you could get tachycardia, breathing issues, your voice, swallowing can be affected. If the jugular vein gets compressed because there's not enough room here, that can give you high brain pressure, brain fog, personality changes. And this just shows it. Good cervical curve, bad cervical curve, and then some of the distances got much narrower.
You're saying the more forward the neck, the more you're just reducing that space that those precious structures need.
You don't think about airway obstruction being the jaw.
Yeah.
CPAP, continuous positive pressure. So in other words, we're going to give you something that you wear, and we're going to force the air into your lungs. It is effective, but it's not curative. There's very few people, like when was the last time you said somebody got on a CPAP machine, then they got off?
Yeah.
Now granted, if they lose a lot of weight, if that's the cause, but in our patient population, they're normally thin. Like it's, people who are loose jointed. But so whenever I see this on a cone beam, it's like, do you snore? Like I had a patient yesterday, like the husband, and the husband immediately, oh yeah. Oh, he did, like immediately.
Yeah, right.
Like it wouldn't be the kind of, like, you always think about somebody who's way overweight and they're the ones that snore.
Yeah.
But it's not normal to snore. It's not normal to snore. And I'll just say something personal, which relates to me. Like I got my Aura ring on, so I've only had it like 4 days.
Okay.
So even right now, it's monitoring me.
Okay.
It's monitoring me. Like there's sensors in here. It's my oxygen. It's my sleep. I mostly use it for sleep. But right now, it'll tell me like what my heart rate is and da-da-da. So I'll give you an example. Like I checked it this morning. So it said my oxygen all night long was 98%. So I was concerned that my fatigue, Dr. Hauser's fatigue, was because I was having sleep apnea. Because my wife would say, you're snoring a lot, you're snoring a lot, you're snoring a lot. My oxygen all night long for the last 3 nights that I've been monitoring it, my oxygen's been completely fine. So I don't have sleep apnea, at least in the last 3 nights. What it also tells you is how much REM sleep and how much deep sleep I've been getting. So the first night, my REM sleep and deep sleep was almost nothing. And that day, which might be how most of us are, when we just feel like awful, like you wake up, the next night, I had more awakenings in the night. And that day, I actually had really good energy. That was the day where my REM sleep and my deep sleep was really good. And then today, it was good. My REM sleep and my deep sleep was good. So obviously, I have good energy today. So again, this is just ways to monitor if you have chronic fatigue. Like how many people have chronic fatigue?
Everybody.
Like brain fog, chronic fatigue. So, but this is often what causes sleep apnea and snoring. The scientific term also is called upper airway resistance syndrome. So this is where people use an oral appliance. You see on the internet, there's specialty clinics that use an oral appliance. So oral appliances open this, moves the jaw forward. But I'm just saying, another thing a person should do is they should help their neck curve, because that's going to increase the space here.
Got it.
Yeah.
Very cool.
Yeah, it's interesting.
I'm sure there's a lot of people watching. They're like, oh gosh, my partner snores. Like,
no,
taking
but
notes.
These are just easy things that you can do.
Yeah, I like it.
And the cool thing is, the oral appliances, they are getting better and better over the counter. And we'll show some of them. So, I mean, that might be a good place to start, but obviously if it's real severe, you go to a specialist.
Yeah.
But this is just a summary of, somebody has TMJ dysfunction, and then we're finding more and more people have elongated styloid. Because people are always like, Doc, how did I get the elongated styloid? Well, if you have, the elongated styloid is a calcified stylomandibular ligament. So the question is, why would that ligament have so much strain on it? Well, obviously, if you're clenching all night and you have TMJ dysfunction, another ligament's going to have the force. So an elongated styloid is just that ligament got calcified. Like a lot of people don't realize, bone spurs are just calcified ligaments most of the time.
How often do you think you see someone with an elongated styloid in your practice?
As it relates to that it's significant, it's probably half of the people. Yeah. So I have an elongated styloid, so it's just a matter of I have to be careful of looking down and to the right, because that's what would compress my jugular vein and vagus on the right. So I moved my mouse to the left. Then I sleep in a position where I don't, I try to not be in this position. So it doesn't mean that everyone needs to be removed, but there are ones where it has to be removed. We already talked about the Pinto's ligament, and that can give all kinds of eustachian tube dysfunction. And then you can have reduction of that space, like we talked about, that you can have between the mandible, the back of the mandible, and C1 and C2. So the dentists who treat many symptoms by manipulating the jaw and doing an oral appliance, they're correct, but there can be an instability component. Sure. So sometimes, even though we're invasive, like making an oral appliance is less invasive than doing TMJ, but I'm sure you found it's very effective. Like TMJ prolotherapy is very effective.
I love TMJ prolotherapy as a provider because that is actually one of the joints that typically gets better quicker.
Yeah.
However, I will say this, whenever I get like a potential patient kind of inquiry about TMJ, every time I'm like, well, how's their neck? Do we know of any neck injuries? Do we know of any whiplash or whatnot? Because there's such a close relation, like we saw between the TMJ and the neck, that sometimes people will come in and they have a TMJ disorder, and it's just that, like it's just localized to the TMJ, fine. But I would say more often than that, there is also like a C1, C2 instability that's putting pressure on the TMJ. And so we really have to, in an effort, of course, of resolving symptoms, look at both.
Yeah, I just wanted to give some clues to people at home. So here are some clues, like obviously, do you feel clicking, popping, grinding? When you open your thing, does your jaw deviate? That, of course, would be TMJ. The other thing is that if you have tinnitus, so if you have, when I just call it, a better term really is probably sound distortion. Like in other words, you're hearing something that, like right now, if I don't talk, I'm not hearing something.
Yeah.
So if you're hearing things, does the quality of what you're hearing change by you manipulating your jaw? So like, in other words, in the middle of the day, if all of a sudden I have a ringing, in other words, like I haven't had it for weeks, then I have it, one of the first things I'll do is I'll go like this. I'll go like this, and I'm moving my jaw.
Yeah.
And does it change? Because if it changes, it's somewhat related to your jaw.
Got it.
The next thing I'll do is I'll put my tongue on the roof of the mouth. So let's just say I can do something.
Yeah.
And it changes the quality of what I'm hearing. The next thing I'll do is I'll go like this.
Okay.
With my tongue at the top, and I'll see, does it go away?
Okay.
Because remember, if you put your tongue at the roof of the mouth, this goes forward immediately. So in other words, if I manipulate my jaw forward, does it go away? Then if it goes away, it's like it's totally the jaw. It's not the neck, it's the jaw. So if this is you, then it's a jaw thing, and that's probably the thing we'd recommend going toward.
Got it.
And then if you also have clicking, popping in your neck, or you have neck, because you and I often say, hey, at rest, do you have a lot of stiffness here? That would give you and I the clue that, there probably is some kind of a neck component too.
I agree.
This just shows these are all the symptoms. I mean, it's weird
it's
to think a little itsy bitsy joint could somehow give you all this, but
Would you say it was dinky? A dinky joint?
It's a dinky joint.
Dinky joint.
Isn't it? It's like so little.
It is. It's very small.
And it's even really close to the skin. Sometimes in the office we'll give them a device, and we don't give them anything sophisticated. It's just a device just to see it helps or doesn't help. So if this helps somewhat, then one of the options for treatment for the person, of course, is just go to a dentist that can make something specific for them. And this was back in the day. This is much younger Ross Hauser, where I would train doctors. Right now, I'm writing a book, so I'm not in the. I'm not training doctors right now, but that's just at the charity clinic.
Very cool.
Training a doctor on TMJ prolotherapy.
So this is 14 patients that you saw. Pain level before Prolo in blue, after Prolo in red. So, yikes, like someone had 10 out of 10 pain before Prolo, and then pretty much most people had no pain, no to little pain afterwards. Same thing for stiffness in their jaw and crunching.
This thing's like 20 years old. If somebody wants to go on the internet, they could even type in autologous blood injection TMJ. There's been plenty of prolotherapy scientific articles on TMJ being effective for prolotherapy. So just type in prolotherapy, for TMJ dysfunction, and you'll see all kinds of articles.
I would agree. That is an area, or this is a joint that has a lot more research in the last decade or so.
Yeah, so that's good.
All right, here.
That's me.
I recognize those glasses. So here's us using ultrasound to treat your TMJ.
You probably treat my TMJ. Well, in 10 years, so you probably treated it like maybe 5 times.
Yeah, I would say probably.
So it's
yeah.
I mean, it's like once every 2 years.
Yeah.
And honestly, the main reason it comes back is just a Brux. And again, I've worked hard on it, but you see really hard cases or difficult cases after they've seen everybody.
Yeah.
So interestingly, the ring, my average pulse rate goes from like 57 to 60. So even during the day, it just shows you my vagal tone is good.
Yeah.
Because it's not like during the day, even though there's 20 patients or 15 patients that have a lot of hard symptoms and they're struggling, some of them. Because I've worked on my vagal tone, my vagus nerves are doing good. I can remain calm. So then you can handle more and more stress. So that's like a sign. If you're having a difficult time handling stress, then probably your vagus nerves are getting compromised. And then, of course, in the office, we check the vagus nerves. We do HRV testing, and then we measure the cross-sectional area to see if the vagus nerve is degenerated or not.